cava is actually all throughout the abdomen. So, because our livers are really friable, we're not going to worry about it until we get down here. The easiest way to find everything is to locate a kidney, because the renal artery and vein are going to be coming in on the medial side. So we've got a renal artery and vein here, and then we've got our deep vessels. So our fun there. Anyway, so you can see that our descending or abdominal aorta is here. It's going to have a much thicker connective tissue covering than our vena cava, which didn't get injected, so it's completely flat. But you can see how nice and thin the walls are. If this guy was flat, it wouldn't be nearly so thin. So this is our inferior vena cava. So again, that was renal artery and vein there. And we're going to follow these guys down. We'll follow them down, and there's a couple of good branches to see terminally. So the vena cava is going to branch off to form the common iliac right and left, and then shove that out of the way. So you can see it underneath the common iliac artery. We'll talk about it again in a second. And then it's going to come out through the body wall to become the femoral vein right here, this little flat thing. And about here is going to become the saphenous, which we can follow down here, and we'll talk about the rest as arteries. So again, abdominal aorta. Now some fairly variable artery here. So this is the uterus, the right side, and so in this connective tissue is the very small ovarian artery. So that's the gonadal artery of a female, and it actually branched off way up here, but sometimes it's so thin that it's difficult to appreciate. And worry about that branch. So the aorta is going to also branch into left and right common iliac, and then because we have fetal pigs, we actually have terminal branches that are the umbilical arteries. So you can see here and here are the right and left umbilical arteries. In between is the bladder, which we're not going to worry about right now. And so those are actually coming off past where the iliacs branch, which wouldn't happen in an adult. Now, a common iliac is going to give off a deep branch right about here, dives into this muscle, and then a so that's the internal iliac, and then we have an external iliac here, and then as it's crossing, exiting the body wall, it's going to become the femoral artery. So the femoral artery, vein, and nerve are all running together down the inside of the thigh. When it hits the knee, it's going to be the saphenous, and then it's also going to give off a deep branch right here, that's going to be the popliteal artery. So over here. Where did you go? That's pretty much it right up there, or close enough. And then it was very difficult to follow these guys as they came down. So we do have this guy, should be our tibial artery, and down here we would have plantar arteries, but we have too much connective tissue to get a good look. The other structure that we can see here is the umbilical vein. So there's two umbilical arteries, one umbilical vein, and the umbilical vein, which on this guy is gigantic, you can see. Remember, is carrying all the oxygenated blood from the placenta, and it's heading up this way to eventually join with the inferior vena cava on the way to the heart. We lose it as it goes to the liver, and because those livers are falling apart, we can't get a good look at it. Anything else?
I don't think so.
That's really everything we can see. We're not going to see the rest of the stuff.
I think that was it.
Okay. Good then.